My name is Denise Akins. I attend Florida State Community College at Jacksonville. I'm in the BSN program. I had to do a teaching presentation, and my topic was about acute coronary syndrome among a population of current cigarette smokers. So acute coronary syndrome is an umbrella term that for situations where blood supply to the heart is suddenly blocked. So acute coronary syndrome, also known as ACS, is a medical emergency. This includes unstable angina, which is chest pain, and a heart attack. So unstable angina is when blood flow to the heart is suddenly slowed or narrowed. The coronary arteries, usually small clots, will form, and it slows the blood flow going to the heart. And then you have a heart attack. So this occurs when the blood flow is completely blocked or is severely reduced. Okay? So like the heart, whenever we don't get enough oxygen to our heart, we lose that part of our heart, and it's damaged, and it doesn't grow back, it doesn't regenerate. So this buildup is caused by fat, cholesterol, or anything that will cause a blockage. So here we have a picture of the heart muscle, and this just shows the damage that is occurring in the heart from a blocked artery. So there are several risk factors for ACS. Some of them are modifiable, which are things that we can change, and some are non-modifiable. So the one that we're going to focus on is cigarette smoking, but we also have high blood pressure, high cholesterol, physical inactivity, diabetes, obesity, alcohol, stress, and poor diet and nutrition. So here we have the things that we can't change. This is our gender. We know from research that males have a higher risk of developing ACS than females. Age, the older you are, the higher your risks are of having a heart attack. And then hereditary, genetics, your family history. We can't change this. So if you have a parent that has died from a heart attack or have heart disease, it increases your chance of developing a heart attack as well. So the signs and symptoms. The first sign of a heart attack, of course, is chest pain or chest pressure. This usually does not stop, and it may increase with activity. You will have pain. This pain can radiate to both arms, to the neck, to the jaw, to the back or the stomach. You may also begin to feel sick to your stomach and develop some nausea and vomiting. Shortness of breath or difficulty breathing. You may have an irregular heartbeat, such as AFib. This is when the heart does not pump efficiently or regular as it should be. You may have skipping heartbeats, such as palpitations. You may become diaphoretic, which means you may begin to sweat, and dizziness and lightheadedness. So what is the treatment for acute coronary syndrome? So immediate treatment is started right away, and this is usually before there's even any diagnosis. So if you come into the ED and you're complaining of chest pain, the first thing they may do is they're going to give you, sublingual nitro. So the nitro, it reduces the workload of the heart, and it helps improve blood flow. This is also going to stop that chest pain. But one of the bad side effects of nitro is going to give you a bad headache. They'll also put you on oxygen just to supplement. You want to keep your oxygen saturations above 90. And then you'll be given an aspirin. This aspirin is to help prevent any further clotting. So once the diagnosis of a heart attack is confirmed, this is usually by a 12-lead EKG. There's two treatments that are the most common. The first one is a thrombolytic. This is a clot-busting medication. This here is going to dissolve the clots that are in the coronary arteries. And the last is a percutaneous coronary intervention. So this is a non-surgical procedure that opens up that blocked artery. So basically this is done in the heart catheterization lab, and what the physician will do, he would use a major vessel. It's usually the groin, the femoral artery, the brachial artery, or the radial artery. He'll take a sheath, go up through that vessel into the heart, and then he may do angioplasty, which is a balloon. So that balloon will basically take that plaque and push it against the wall to open up the artery. Or he may also put in a stent, which is a mesh tube that will open up the artery and keep the blood flow going as well. So our main goal here, we don't want to have the signs and symptoms of a heart attack. We don't want to go through the treatment of a heart attack. So we want to reduce our risk factors. So as you see, cigarette smoking causes about 1 in every 5 deaths in the United States each year. And this is the main preventable cause of death in the United States. Smoking clearly harms every organ in your body, most importantly, your heart and your blood vessels. One of the best ways to reduce your risk of heart disease is to avoid tobacco smoke, which includes secondhand smoke as well. Quitting smoking is possible, but it can be hard. Millions of people have quit smoking successfully and have remained non-smokers. And there's a variety of strategies that people have used. This includes 1, getting brief help by a doctor, individual, group, telephone, or telephone counseling, behavioral therapies, and then medications for quitting. These are nicotine replacement drugs. So they're basically going to stop that urge of wanting to smoke and have nicotine. These can be over-the-counter nicotine patches or prescriptions. So here, there's numerous resources on the internet. There's free support, advice, counseling, and experienced quit-line coaches. So the first thing, when you want to decide to quit smoking, you need to have your own personalized quit plan. It's also good to search for any of the latest information about drugs that can help you quit smoking. And then read inspiring stories from former smokers and their reasons to quit. Thank you. And then here's my survey of questions. Just goes over how would you rate the presentation? Did I speak natural? And were the visual aids effective and appropriate? And those are my references.